Ankylosing spondylitis, or AS, is an inflammatory arthritis condition that primarily affects the spine and sacroiliac joints. Treatment often involves various types of medications to manage pain, inflammation, and to prevent further joint damage. These medications can be categorized into the following groups: non-steroidal anti-inflammatory drugs, or NSAIDs, disease-modifying anti-rheumatic drugs, or DMARDs, biologic therapies such as TNF inhibitors and IL-17 inhibitors, Janus kinase inhibitors or JAK inhibitors, corticosteroids, and analgesics or pain relievers. The first line of treatment for pain and inflammation in AS is often NSAIDs. Common examples of NSAIDs include ibuprofen, naproxen, and diclofenac. These drugs work by blocking the production of prostaglandins, which are chemicals in the body that are involved in inflammation and pain. While NSAIDs can be highly effective for short-term relief, long-term use comes with potential risks, such as gastrointestinal issues, kidney damage, and cardiovascular problems. Therefore, they are typically used with caution. When NSAIDs are not enough to control symptoms, doctors may turn to disease-modifying anti-rheumatic drugs. These drugs help slow the progression of the disease and reduce inflammation. Examples include sulfasalazine and methotrexate. Although methotrexate is more commonly used for other forms of arthritis, it can be effective for treating peripheral joint involvement in AS. DMARDs work by suppressing the immune system and altering the underlying disease process. However, they require close monitoring for potential side effects, including liver toxicity, blood abnormalities, and lung problems. For more severe cases of AS, especially when NSAIDs or DMARDs do not provide sufficient relief, biologic therapies are often used. These include TNF inhibitors and IL-17 inhibitors. TNF inhibitors block TNF-alpha, a pro-inflammatory cytokine that plays a significant role in AS. IL-17 inhibitors target another inflammatory mediator involved in the disease process. These biologic therapies are effective in reducing inflammation, improving mobility, and preventing structural damage to the spine and joints. They are typically administered via injection or infusion, but come with the risk of increased infections and require regular monitoring for potential side effects, such as reactivation of tuberculosis. A newer class of drugs, known as JAK inhibitors, may be considered for patients who do not respond to biologics. These oral medications work by blocking enzymes involved in the inflammatory signaling pathways. JAK inhibitors can help control inflammation and symptoms in AS but may come with side effects such as infections, blood clots, and elevated cholesterol levels. In cases of short-term flare-ups or localized inflammation, corticosteroids can provide rapid relief. They suppress the immune system and reduce inflammation but are typically used sparingly, as long-term use can lead to significant side effects like osteoporosis, weight gain, high blood pressure, and diabetes. For pain relief, without addressing inflammation, analgesics may be used. Medications like acetaminophen are effective for mild to moderate pain, while opioids may be prescribed for severe pain, although they are generally avoided due to the risk of dependency. While analgesics can help manage pain, they do not modify the disease itself, so they are not used as the primary treatment for AS. Each of these medications plays a specific role in managing ankylosing spondylitis, and the choice of treatment depends on the severity of the disease and the individual patient's health. Regular follow-up with healthcare providers is essential to monitor for potential side effects and adjust treatment as necessary to achieve the most effective outcomes. Thank you for watching. If you found this video helpful, please give it a thumbs up. It supports the channel. Don't forget to subscribe and get notifications for updates and informational videos about ankylosing spondylitis, and leave a comment. We would love to hear from you.